Welcome back, dear viewers, and you're still on the Breakfast Show. And as we said, our third topic is talking about the health care system in Egypt. For many years, the public discourse has centered on issues such as overcrowding the workforce, shortages, infrastructure elimination, and the financial burden of the healthcare on the citizens. However, the recent years have witnessed significant reforms and investments to transforming this sector. Details in the coming report, and will be come back to shed more light over the phone with our guests.
Egypt's healthcare sector stands at a pivotal moment in the modern history. For decades, the system has struggled under the weight of rapid population growth, limited public spending, and rising demand for increasingly sophisticated medical services. These pressures created significant disparities in healthcare quality and access across regions and socioeconomic groups. In recent years, however, Egypt has embarked on one of the most ambitious healthcare reform agendas in the Middle East and Africa. Large-scale investments in infrastructure, the gradual implementation of the universal health insurance system, extensive public health campaigns, digital transformation initiatives, and expanded healthcare coverage have begun to reshape the sector. While substantial challenges remain, many patients and healthcare professionals acknowledge measurable improvements in hospital facilities, disease prevention programs, diagnostic capabilities, emergency response systems, and access to specialized treatment. The ultimate success of these reforms will depend on sustainability, governance, workforce retention, equitable resource allocation, and the ability to maintain quality and continuing population growth. For many years, Egypt's healthcare system operated through a fragmented structure, and now the country's demographic profile has consistently placed pressure on healthcare services. With a population of exceeding 100 million citizens, demand for medical care has grown faster than the capacity, and that the responsibilities are now sufficient and efficient to stand all these challenges.
And shed more light over the health care system in Egypt. Here we are joined over the phone by Dr. Islam Anan, the professor of the Pharma economics. A very good morning to you, Dr. Islam. Welcome to the Breakfast Show.
Good morning, and thanks for having me.
Thank you so much. In your point of view, how would you evaluate the current state of Egypt's the healthcare system compared to 5 or 10 years ago?
A very good question. So I believe to answer this question, the most important thing is to compare where Egypt stood 10 years ago and where it stands today.
Yes.
As the report was actually mentioning, historically Egypt faced many challenges. That's correct. Mainly the rapid growing nation. We have increased population demands. We have pressure on healthcare infrastructure, workforce shortage. And if we remember, at the 90s, we were like 70% out-of-pocket expenditure. However, if we look at the last decade, Egypt has undertaken one of the most comprehensive healthcare transformation programs in its history, actually. We have witnessed major investment in infrastructure, healthcare financing reform, digital health, the inauguration of the universal health insurance, the disease prevention program for 100 million healthy lives. We have the eradication of a lot of diseases, the public initiatives. The discussion now is no longer about the healthcare access. We're currently discussing a lot about the quality, sustainability. We have a lot of times we were discussing recognition for Egypt, for example, for eradication of hepatitis C, for malaria, for polio, for leishmania. So we are having a lot of success milestones, which is compared to the 90s and early 2000s, it's a complete difference. And if we actually look even at the out-of-pocket expenditure, we are witnessing a regression where currently it's like 50% out-of-pocket and 50% governmental. And we are expecting that by 2035, when we implement the UHI and the universal health insurance for all government rates, the out-of-pocket will decrease to less than 20%. So it's not simply just launching an insurance scheme.
Yes.
The universal health insurance is a complete redesign on how healthcare is financed, regulated, purchased, and delivered, because you split already the bodies responsible for service delivery, for finance, and for accreditation. Like we have now the GAHAR for accreditation, we have the Unified Purchase Authority for procurement and purchase, we have the Egyptian Health Authority only for provide the service. So you have a complete governance.
Yes.
And this complete governance made Egypt to establish a modern healthcare financing model based on the strategic purchasing, as we were saying. This system will be implemented gradually, as I was saying. Each year would have new government rates, and the aim ultimately is to provide this comprehensive healthcare coverage by 2035 to every Egyptian citizen.
Yes, Dr. Islam, also, which are the long-standing challenges continue to hinder the healthcare delivery despite the recent reforms?
So if we are talking about the challenges, we had a lot of challenges, and every healthcare worldwide, especially when we are facing the economic global challenges that's happening currently, and the national security thing and the global security thing, there are a lot of challenges for all healthcare systems worldwide. And mainly the main thing is how to maintain supply chain, sustainable supply chain. And we have every couple of years a disruption in supply chain. We had COVID, we had the Russian-Ukrainian conflict, we had the conflict all in our borders with the neighbors. We have as well current war and the closure of Hormuz. So the sustainability of having the flow and the access of the active pharmaceutical ingredients and the products to be available in the pharmacies, this is one of the biggest challenges worldwide. And as we can see, we do have very limited problems in terms of supply chain, alhamdulillah, in Egypt. So the medications are already there, and this is actually based on we have a good localization file. We are producing locally 91% of our needs in pharmaceutical industry. 91% is a very high percentage. We only import completely 8% of the medication. This is just to give you an example about the supply chain. Another one is how we can make the people access the healthcare with an easy way. Previously, it was tedious, and logistics paperwork was actually very tedious for all the citizens to go through the paperwork to have the service done. Currently, and under the new healthcare system, they can just book their appointment across the hotline with the phone call, and then they go see the family practitioner, and if needed, they can go referred to the secondary care, the specialist, and so on. This was actually solved by the digitalization file, and hence the digital health and the digitalization file are very, very much important on making the service delivery easier to the citizen.
Yes, and in your point of view, how effective is the universal health insurance system can or has been expanding in the healthcare coverage?
So currently we do have coverage to around 6 million Egyptians. We are in the first phase pilot, and we launched the second phase. And we are aiming to add another 10 to 11 million approximately. And this second phase is very important because it will be the expansion phase. And then year after year, you will start gaining more government rates with more coverage, with more millions, till you reach the big cities, which is finally it will be, of course, Greater Cairo. That will be the last government rate to cover, and the hardest one, of course. But for example, this year, Mania will be included, which is a very big government rate, more than a couple of million government rate, which is will demonstrate the power of the healthcare system, the new one. And mainly the coverage, it starts with having a good infrastructure for hospitals, accredited, all of them from a GAHAR body, and then adding the service delivery and procurement from the UPE and the financing body, which is based on the family itself. We have the subscription from the family, which is and the good sustainability of the program.
Well, Dr. Islam, also to what extent has the public confidence in government healthcare service has been improved in your point of view?
That's another very good point, because look at, for example, the eradication of virus C program.
Yes.
We were not expecting that people would be actually going to make a screening, especially if we are talking about going to screening and they don't have a disease. Most patients, they don't have the culture to go make any medical service without any symptoms.
Yes.
And take, for example, we rarely go to our dentist unless we are actually suffering and we are in pain. So in hepatitis C, we actually got around 50 million visits for the hepatitis C screening. You can imagine the figure. 50 million Egyptians went to have a screening without having any symptoms. And this is a pure confidence. And by the way, this is a Guinness record screening their nation have ever happened worldwide.
Yes.
So this demonstrates that there is a complete transformation to the image of healthcare in our mind as Egyptians. We go take the service, because when you go once and have a good service, you build a good image and you go again. And that's why people repeated the visits in the healthcare system. So you have 50 million for hepatitis C, but you get total around 130 million visits from Egyptians to the public health initiatives and the presidential initiatives.
Yes.
You have 15 presidential initiatives. Take, for example, what's happening for the universal health coverage in Port Said, for example, and the Canal government rates. People are actually heading to the new healthcare system, and we have a 100% uptake. By 100% uptake, I mean people are shifting from the old healthcare system to the new. There is no withdrawal, there is no complaint, for example, there is no people saying, I want my old healthcare back again. No, I'm really satisfied with the new one. And this gives a good credibility to the system. We have a complete transformation. And what's most important, because any healthcare system and healthcare system in Egypt, the main objective is the human being. Are we satisfied or not?
Absolutely.
And hence the satisfaction of the citizen from the system.
Dr. Islam Anan, the professor of the Pharma Economics, thank you so much for joining us in the breakfast show and for your insightful information. And this brings us, ladies and gentlemen, to the end of our breakfast show for today's episode. Thank you so much for watching and stay tuned. It was Talawi for this today episode.